Hello everyone, I am Shobha Christilla, Assistant Professor, Department of Biomedical Engineering, Hindustan College of Engineering and Technology, Coimbatore. Today's topic is ECG interpretation. So this is the overview of our presentation. First we will see about conduction pathways, then we will see about systemic interpretation, then we will see about the common abnormalities in critical care, which includes supraventricular arrhythmias and ventricular arrhythmias. So this is the typical diagram of a conduction pathway. It starts with the SA node. So the SA node has 6 to 100 beats per minute. From then it travels through the internodal tracts. It will go to the atrioventricular nodes. So that is having a conduction pathway of 60 bpm, that is beats per minute. Then it comes to the atrioventricular node, which is called as bundle of His. That is having a beats of 40 to 60 bpm. Then it comes to the left bundle of branch. Then it comes to the Purkinje fibers, left and right bundle of branch. Then it comes to the Purkinje fibers. So this is the conduction pathway of the heart. Next we will see what is the ECG means. So ECG is typically made up of these symbols. First we will see about P wave. P wave means atrial depolarization. Then PR interval, that is the impulse from the atria to the ventricles. Then you have QRS complex, that is nothing but ventricular depolarization. Then you have ST segment, which is an isoelectric point. It is a part of repolarization. Then you have a T wave, which is usually same direction as QRS. So it is ventricular repolarization. Then you have an interval called QT interval. This interval spans the onset of depolarization to the completion of repolarization of the ventricles. So we have depolarization and repolarization happening simultaneously in the conduction pathway of the heart. So here you can see how to read an ECG graph. So here you can see the time versus voltage split up, and each box, it is a 20-second duration box, and each small box inside that box is a 4-second duration box. Okay, so this is the typical time split up of ECG interpretation. Now we will see how to calculate the rate. Rate is nothing but number of P's, that is atrial, and R, which is ventricular, per minute. Okay, so P rate is 8 into 810, that is mean by 80, and R rate is 8 into 10, that is 80. So you have to convert the number of P's multiplied with 10 and the number of R's multiplied with 10. That gives you your minute rate. So rhythm means it is a regular rhythm or irregular rhythm. It's based on the mapping of PP interval and RR interval. Next we will see what is named by P wave. P wave is present 1 per QRS, and you can see the shape, duration and the voltage. So PR interval is the length, which is an isoelectric point, and it is having a time duration of 0.12 to 0.2 seconds. Then you can see a typical QRS complex, which is the duration of 0.06 to 0.10 of voltage. So you can see the Q waves and the duration. Then you have an IST segment, which is an isoelectric point with the PR segment. Next you can see the T wave, which is a shape with direction. Then you can see a length QT interval, which is having a duration of less than 0.40 seconds. Now we will see what are the abnormalities in the ECG wave pattern. So you have supraventricular arrhythmias, main abnormality, which is associated with atrial fibrillation, atrial flutter, supraventricular tachycardia. And in the abnormalities, ventricular arrhythmias regarding ventricles, you have premature ventricular complexes, which is called as PAC. Then you can see how the conduction pathway is taking place. So you have supraventricular narrow QRS complex, then you have ventricular wide QRS complex. So these are the abnormalities that may be associated with the conduction pathways. Now we will see what are the abnormalities of the atria, that is atrial fibrillation. When a person is having atrial fibrillation, his rhythm will be irregular. The rate of atria with ventricles, it varies. And P, that is purely defined, and PR is not available. QRS is very narrow, ST is normal, T is normal, and QT is normal. Then you can see how an ECG will be for atrial flutter. So when a patient is having atrial flutter, his rhythm will be regular or irregular. The rate is 220 to 430. So it is a sawtooth appearance, and here PR interval is not available. QRS is a narrow complex, ST is normal, T is normal, and QT is normal. Then we can see a typical abnormality waveform of a supraventricular tachycardia. So here the rhythm is normal, but the rate is very high, which is more than 100. And P wave is not visible, PR is not defined, and QRS is a very narrow complex, and ST depression will be there, and the T is normal and QT is prolonged. So this is a typical tachycardia condition. Next we will see some of the premature ventricular complexes. These are the waves we can see. It is irregular waves of premature ventricular complexes. So thank you for your patient listening. Thank you.